Good evening, everyone. Welcome one and all. Thank you for joining us on a cold January evening. If you've come to join us for a presentation about the ABCs of back to in-person learning, you've come to the right place. My name is Brittany Cadence. I'm the Communications Manager with Peterborough Public Health, and it gives me great pleasure to be the moderator for you this evening. Tonight's presentation is very much a collaborative effort and jointly produced by 3 public health units and 3 boards of education, whose jurisdictions overlap a wide swath of central and eastern Ontario. Our partners tonight are Durham Region, Haliburton Kawartha Pine Ridge District Health Unit, Peterborough Public Health, and for our school board partners, they are Kawartha Pine Ridge District School Board and the Peterborough, Victoria, Northumberland, and Clarington District School Board, Catholic School Board, as well as Conseil Scolaire Catholique Mon Avenir. Tonight's presentation will take about an hour, and you'll get to hear from our local medical experts to answer your frequently asked questions about the return to school. All the partner agencies have been gathering questions from parents and students so that we could gather here today, this evening, to learn and share information that will empower school families as they prepare for the reopening of schools on Monday. Next slide, please. Before we begin, I'd like us to just take a moment to honor this special place that we call home. We respectfully acknowledge that the land on which we gather is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beau Soleil, and Georgina Island First Nations. We respectfully acknowledge that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. We would also like to recognize the unique history, culture, and traditions of the many Indigenous peoples with whom we share this time and space. We give thanks to the Métis, the Inuit, and the many other First Nations people for their contributions as we strengthen ties, serve their communities, and responsibly honor all of our relations. Next slide, please. So for tonight's presentation, we're very fortunate to have 3 amazing medical experts with us. They include Dr. Thomas Pigott, Medical Officer of Health with Peterborough Public Health, Dr. Natalie Bocking, the Medical Officer of Health with the Haliburton Kawartha Pine Ridge District Health Unit, and Dr. Pepe McTavish, Associate Medical Officer of Health with the Durham Region Health Department. Next slide, please. So to start us off this evening, I'm pleased to introduce our boards of education, and we have with us representatives from 3 local boards of education, and we'll start off with Rita Russo, who's joining us as the Director of Education from the Kawartha Pine Ridge District School Board. Please go ahead, Rita.
Thank you. Good evening, everyone. I'd like to begin by thanking Dr. Bocking, Dr. McTavish, Dr. Pigott, and my director colleagues, Kerher and Bergeron Langlois, for this opportunity tonight. It continues to be a complex journey from one school year to another, and I'm thankful that our respective organizations continue to work collaboratively daily in service of our students and families. We know that safeguarding the health and safety of children, our students, is our parents' greatest priority, and we want to reassure parents and the community that we too share that priority. Nothing is more important to us than the safety of our students and our staff. It is a commitment that we hold in common with our partners in public health and has been the guiding force in our planning to date. We continue to work through these months of challenge, these months of change, and we are incredibly proud of the strength and the resilience that our students and staff have demonstrated through these difficult and demanding times. We know that you have many questions as we return to in-person learning on Monday, and we hope that tonight's discussion helps share our back to school planning that reflects the guidelines and directives from our local public health partners, the provincial health officials, including our Chief Medical Officer of Health for Ontario. As I wrap up my comments, I would like to say that no plan is perfect, and we continue to receive feedback, to consult, to reflect, and to refine our actions each day in partnership with our public health. And finally, I want to emphasize how critically important it is for families and students to perform screening each day. When parents screen their children every day before school and keep them home if they're ill, we can continue to provide healthy learning environments for everyone. So thanks again for the opportunity to speak with you today, and we look forward to welcoming you back to in-person learning on Monday. Thanks.
Thank you very much. Okay, let's hear from Joan Carragher, who's joining us as the Director of Education from the Peterborough, Victoria, Northumberland, and Clarington Catholic District School Board. Please go ahead.
Thank you, Brittany. Good evening. I'd like to thank our panelists for bringing together this valuable resource for families as we return to in-person learning on Monday. I also want to take this opportunity to express my profound gratitude to the public health agencies and all the public health staff who have and who continue to work tirelessly to help keep our schools safe. I can't stress enough how important our collaboration has been with the 3 local public health agencies represented here tonight. Days, nights, holidays, public health has been there to take our calls, to offer advice, and to help us manage this pandemic in our schools. We have learned to be flexible and adaptable together, and Omicron is certainly providing us with new challenges and resulting in changes to our processes. I also want to tell you, the parents, guardians, and educators who are listening, that you too have been extraordinary during the last 21 months. Your patience, flexibility, understanding, and support have made these challenging times more manageable. Thank you for that. We hope that tonight's webinar answers some of your pressing questions and assures you that we continue to work together collaboratively to keep our schools as safe as possible. Thank you.
Thank you very much, Joan. And now for some opening remarks, we will hear from Mélanie Bergeron-Langlois from the Conseil scolaire catholique Mon Avenir. Go ahead, Mélanie.
Bonsoir, good evening. I will speak in both French and English this evening. En préparation pour le retour en présentiel, l'importance pour nous est de garder les classes ainsi que les écoles ouvertes et tous les départs seront déployés pour assurer la continuité des apprentissages pour les élèves. Nous allons respecter toutes les mesures sanitaires et opérationnelles suggérées par le ministère de l'Éducation en collaboration avec les bureaux de santé publique. Depuis la rentrée, nous avons maintenu le dépistage actif quotidien via un formulaire électronique et nous remercions les parents pour leur collaboration à cet effet. Nous allons maintenir cette même approche avec l'outil provincial renouvelé et les parents ont déjà reçu le lien hier par courriel. In preparation for the return to in-person learning, the importance for us is to keep classes as well as school open, and every effort will be made to ensure the continuity of learning for all students in our classes. We will respect measures recommended by the Ministry of Education in collaboration with the local health unit. Since the beginning of the school year, we maintain an active school screening for students, and we thank the parents and the community for the collaboration in this regard. We will maintain this with the renewed provincial screening tool. The parents have already received a link to the school screening tool yesterday. Merci pour votre temps ce soir et au plaisir de revoir nos élèves lundi prochain. We are looking forward to seeing our students on Monday.
Merci. Okay, so before us, we see the agenda for this evening. So we will walk through the current COVID-19 context, then a discussion on preventative measures in schools, highlights changes to COVID-19 reporting in schools, and then end with frequently asked questions. So to start us off with the first agenda item, the current COVID-19 context, I'd like to introduce Dr. Thomas Pigott, Medical Officer of Health from Peterborough Public Health. Go ahead, Dr. Pigott.
Good evening, everyone. Bonsoir à tous. J'espère que ça va bien cette semaine et durant le temps très difficile de COVID-19 maintenant. Je vais parler un peu en français et je suis ici s'il y a les questions en français aussi, but I'll continue in English for now and talk about the current context of COVID-19. You'll know this well from all of the media and attention to this. It's a very difficult time because so much is changing and there's so much information out there. But the Omicron variant was detected back in November in Ontario. And since then, we've seen a significant rise in the case counts in Ontario to such a degree that from a public health standpoint, we've had to change the approach in order to manage and in order to mitigate the consequences, especially the severe consequences like hospitalization and death due to this ongoing pandemic. This has meant, because the challenges with accessing PCR testing were so significant, a narrowing, a restriction of the criteria of who is eligible for a PCR test and restricting that to the highest risk settings, including healthcare settings, long-term care, those kinds of settings, as well as Indigenous communities. And so the changes have also had an impact and a change on how public health has been managing this pandemic, and our need to focus in efforts on case and contact management in terms of the outbreaks in long-term care settings and those kinds of other settings where people are at the highest risk of severe COVID. That does not mean we are abandoning or decreasing our work and supports to schools. To the contrary, we are increasing them and are here. The supports will look different though, and that is because the inability to know that cases are potentially in schools mean that we'll have to rely on things such as absenteeism, and we'll have to support in other ways. So our health unit, and I know my neighboring health units, have been really busy over the last couple of weeks preparing towards in-person learning and working extremely closely with our school board partners to better understand their questions, their needs, and all of the measures that they're putting in place. So if you advance the slide, please, Kim. On the next slide, you can see some of the measures and work that's been done. In this province, there has been significant investment and work done to improve the safety of school environments. This includes tighter mask use and better quality masks, improvements to ventilation in school settings, other measures and restrictions, including the new screening tool that was mentioned, as well as access to rapid antigen tests for students and staff. These measures are all really important. And on the next slide, Kim, you'll see how we can't just use and rely on one measure. It's going to take multiple measures to help to protect our kids and our communities. So certainly some of the public health measures, such as avoiding large gatherings and physical distancing, are important, but there's also all of the measures that have been put in place in schools, including improvements to ventilation, wearing a mask, and of course, more than anything else, getting the COVID-19 vaccine to ensure that you're protected. And so if you haven't had the opportunity to get the COVID-19 vaccine, I strongly recommend that you do so whenever you are due for a second dose, to do so as well. I think it's critical for students and teachers and other staff to have this for protection. And to talk a little bit more about the vaccine, I'll now turn it over to Dr. Bocking. Thank you.
Great. Thank you, Dr. Pigott, and good evening, everyone. My name is Natalie Bocking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit. So the next two slides I'm going to cover, and it's around vaccination. So vaccination remains one of the most important tools that we have in preventing the spread of COVID-19, and in particular, preventing serious illness related to COVID-19 infection. We know that the COVID-19 vaccines are safe and they are effective. A couple of, I think, important reminders that we still sometimes hear related to questions. The vaccine does not cause COVID-19 infection. There are sometimes side effects from the vaccine. In children, these are generally mild side effects, either related to where the vaccine is injected, so on the arm, or sometimes a couple of days of broader flu-like symptoms. We do, if you move to the next slide, please, Kim. A quick run through of the eligibility. So we know that the Pfizer vaccine, there's a pediatric formulation that's approved for use among kids that are ages 5 to 11. There's been some confusion about does your child have to be 5 or just born in the year that they turn 5. The current regulations are that they must be 5 at the time that they receive their vaccine. So if they're 4 right now, they're turning 5 in April, they have to wait until April till they get that first dose. We know that the province is continuing to look at that, but that's the recommendations right now. Also recommended that there be 8 weeks in between the first and the second dose, and that's really the optimal timing for the best immune response. The product Monograph is approved for earlier, a shorter time period. So if parents are quite anxious and would like it to be a shorter time period between the first and the second dose, it has to be a minimum of 21 days, but otherwise between 21 days up to 8 weeks is still possible. The Pfizer adult formulation for COVID-19 vaccination is also recommended for youth age 12 to 17. Also 2 doses of vaccine recommended. Booster dose is not currently available for youth 12 to 17 years of age. We know that the FDA has approved this in the United States, and Health Canada and the National Advisory Committee on Immunization continue to look at this. And then, of course, adults, anyone age 18 and over, we are continuing to encourage vaccination. If you don't have your booster dose yet, please do so. We know that they are effective and very important at helping, again, to prevent serious illness related to COVID-19 infection. So I'm now going to pass over to Dr. McTavish to go through the next couple of slides in the next topic.
Thanks, Dr. Bocking. So I'm going to go through the daily screening tools, symptoms, and then self-isolation. So if you're like me, you'll need to bookmark this on your computer or on your phone, tablet, because we're going to be doing it every day. So just like before, but the screening changes, evidence changes, so it changes along with it. So we'll need to do the daily screening every day, so you can just bookmark it, and it sounds like most school boards have already sent this out to parents and students. It needs to be done every day. How every school board will be collecting it will look a little bit different, so your school board will let you know whether it's a daily attestation. Some places still accept a paper copy sort of scanned in sometimes if you don't have access to the internet, so it just looks different for every school. And then the new recommendations for isolation are based on age and vaccination status, and if you're a contact of someone with COVID-19 or experiencing symptoms, because now we sort of assume most people in the community experiencing symptoms do have COVID-19. So this is sort of like before we were at school, we have to do this every day again. So next slide, Kim. Perfect. So here's the symptoms. So if you don't remember any of this, that's okay. They change with the evidence. We had a couple of revisions last year and even this year. So if you don't remember, that's fine. You're going to go onto the website. You're going to Google COVID-19 school screen, and it's going to come up. You're going to have the link from your school board, and you're going to bookmark it. So you're going to have it every day. So you'll just go on and you'll just click it, right? You'll just click right through. So right now, if any students are experiencing symptoms of COVID-19, they should not attend school. We know this from before, and this is different from years gone by where we all went to work in school a little bit symptomatic, right? A little bit different now, and the screener tells you this, is that household members need to also isolate along with the symptomatic person. So let's say my 7-year-old is symptomatic. I need to isolate. I can't go to work while my 7-year-old is symptomatic. The screener tells you this. It says stay home. Household members need to stay home if you end up being sort of screen positive. So the big symptoms we think about are the big ones: fever and chills, or a cough, or shortness of breath, or a decrease or loss of taste or smell. Or you can have 2 or more of the following. So muscle aches or joint pain, extreme tiredness, a sore throat, a runny nose, a headache, or some GI symptoms, so nausea, vomiting, or diarrhea. So again, you don't need to remember these, they're on the screening tool. So next slide, please, Kim. So isolation requirements. So again, if you do the screening tool, it will tell you what you need to know. This is just more for your information, so you don't need to memorize this or worry if you can't remember it, because I don't always remember it either. Sometimes I do the screening tool myself to know what the requirements are. So no surprise, if you test positive or student test positive on the rapid test or on a regular PCR test that you would get at the assessment centers, you need to stay home. No surprise. If you have 1 symptom commonly associated with COVID-19. So those are the first symptoms I read out to you before. So that's fever, cough, shortness of breath, or change in your taste or smell. Those are the ones where you have to stay home. Where it's a little different is the following one. So if you have 2 of the following symptoms, you need to stay home. Again, the screener will tell you. If you click on 2 of those, it will tell you to stay home. If you click on 1 of them, it will tell you you can go. So that's runny nose, headache, very tired, a sore throat, muscle aches, or that nausea, vomiting, diarrhea symptoms again. You also need to stay home if you're a high-risk contact or a household member of someone with symptoms or a positive test. So again, if I became positive, my children would not be able to go to school because they would be household contacts of me with somebody who has symptoms or a positive test. And again, the screener will tell you all that. I think that's my last slide. Nope, next slide for me, Kim. Perfect. So this is my last slide, and then we'll pass it back over. So again, this is on the screener. If you do the screening tool and it says you get the red sort of X that we saw on the first slide that I was presenting, it will tell you what to do. Okay. Most of the time it will connect you to the Ontario.ca Expose site. It's a very good site, and it tells you what to do for your isolation requirements. So in general, if you're 12 years of age and older and you're fully vaccinated, or you're 11 years and younger, regardless of your vaccination status, you need to isolate for 5 days from your symptom onset until your symptoms have been improving for at least a day. It's a little bit different if it's nausea, vomiting, diarrhea, different illnesses. That's, a 2-day, 48-day window. So whatever is longer. So most people need to stay home for at least 5 days if they have symptoms. Sometimes people have to stay home for 10 days from your symptom onset, and that is if you are not vaccinated or partially vaccinated and you're 12 plus, or if you're immune compromised. So people know when they're immune compromised, maybe you're on special medications. It just decreases your immune system a little bit. So we just like to make sure that you're home for the 10 days. So again, if you can't remember this, that's okay. On the website, it'll tell you, and then it will link to where you need to go for isolation requirements. So that's it for me, Kim. So back over, I think it's back to Dr. Piggott. Thanks.
Thanks. We're going to talk about masks now. With Omicron now here, we need to up our mask game. We know that with it being more transmissible, it's really important that a better quality masks, more tightly fitting masks are used. So for students, there's information, and school boards are receiving higher quality masks. And for teachers, staff, education staff, that is, they are being provided with the option of a non-fit tested N95 mask. And so these improved masks will definitely help in the context of Omicron. On to the next slide, Kim. We'll speak briefly about cohorting. And so what's important, overall, and I've been talking to our school boards about, is as much outdoor time as possible. Outside time's always safer than indoors. And when kids are out on breaks, they will be cohorting to try to ensure that they're limiting the number of contacts, and the school boards are working on that. But there's also indoor measures that are being taken to make sure that we decrease the number of contacts that students have. And on to the next slide there, please, Kim, and I'll pass it back over to Dr. Bocking.
Okay, thanks. And I think it just in follow-up related to additional protective measures in school when school resumes in person next week. As a temporary measure, there's a couple of activities that will be paused. And this is aimed at reducing contacts between students and staff, especially in those settings that there's physical exertion, that people might be breathing out extra air and in close proximity to other students. So there will be a pause of any indoor high contact and high intensity extracurricular activities. As well as some music extracurriculars, so multi-cohort choirs and wind instrument ensembles. And in addition, there will be a pause on in-person assemblies in elementary schools. Again, these are temporary measures, and I think will continue to be revisited with both the provincial team that's developing our guidance documents, as well as our partners at the Boards of Education. So next slide, please, Kim. So the next 2 slides focus on testing, which I know is another kind of hot topic. So PCR testing really has been the gold standard for the last 2 years. Given the nature of Omicron, how easily it spreads, and the number of infections that it causes, The province has limited now access to PCR testing through assessment centers. This means that education staff and students will not likely have access to PCR testing. You might recall prior to the holidays, the Ministry of Education did distribute some PCR swabs to schools that could be given to students or staff that were symptomatic at school. Now, only a small number of swabs were distributed to schools, and not all schools have them. We've been informed that at this point in time, they don't intend to replenish that supply of PCR swabs at schools. Instead, it will be looking towards rapid antigen tests. So this means we won't have PCR results for the vast majority of students or staff that may be symptomatic of COVID-19. If there is a positive PCR result, then people will be asked to self-isolate according to the Dr. McTavish already outlined. And if they happen to have access and have a negative PCR result, they will still be asked to stay at home until it's been at least 24 hours of symptoms improving, or 48 hours if it's vomiting or diarrhea, what we call gastrointestinal symptoms. Next slide, please. So rapid antigen tests, we are viewing slightly differently with the Omicron wave now. When we had ready access to PCR tests, we were recommending at that time that if you had a positive result on a rapid antigen test, that you should get that confirmed with a PCR test. Now that there is so many infections caused by the Omicron variant in the community, we know that if somebody tests positive on a rapid antigen test, it's very, very likely that it's a true positive, that somebody really does have COVID-19. As such, if you have a positive test on a rapid antigen kit at home, we assume that it's positive and it does not need to be confirmed with a PCR test. Now, if somebody is symptomatic and you have a rapid antigen test at home and you do that first test and it's negative, that's great. We don't take one negative test on rapid antigen test as kind of at face value for what it is there. We recommend that there be 2 negative rapid antigen test results separated by at least 24 to 48 hours. If both of those tests are negative, the person with symptoms is much less likely to have COVID-19. We would still recommend that they isolate until their symptoms have been improving for at least 24 hours. Again, 48 hours if it's GI symptoms. But if you have those 2 negative rapid antigen tests, once feeling better, you don't need to isolate anymore, and household members would not need to continue to isolate either. And with that, I'm going to pass it back over to Dr. McTavish for the next slide.
Excellent. Thanks very much, Dr. Bocking. So Dr. Pigott sort of stole my thunder on this slide on his introduction. He was talking about changes to COVID-19 reporting in schools, so I'll just reiterate it. Although it's changing, public health units are still very, very involved with local schools, local school boards, with our school-focused nurses. We're all still in this together. Just the reporting changes a little bit. As you may remember before, it was sort of if you had a case, the school nurses would contact you and say, you know, it's been a case in this class. We need to isolate, go for testing. We're going to dismiss this cohort. So we'll be a little bit more behind the scenes now, I would say. So we're still very involved. There just won't be class and cohort dismissals anymore. It doesn't, not to say that couldn't happen, but that's sort of not the primary focus like it was before. So given the broad transmission and our inability to test everybody, like Dr. Bocking said, we're not going to be routinely notified of these positive cases because you won't know, schools won't know. So public health will not be taking the same approach that we did before, like I just mentioned. So parents and guardians do not have to report if the child has a positive either PCR test from the assessment centers or those rapid antigen tests. We don't need to know about them. You still need to follow the guidance, fill out the online tool, do your 5 or 10 day isolation. But we will not need to know at the public health department. But schools will still need to submit their absenteeism. So parents will find out from the school. So if a level gets too high and so many students are absent from school, then the school will let parents know and public health will be involved and certainly can assist in many ways to make sure that school is still a great place for people to be. And so we'll still support in the background. So please don't think that this means that your local public health unit is not involved. We certainly are. It just looks a little bit different right now. So we'll have to just adjust as we go. So back over, I think it's back to Dr. Pigott now. Thanks.
Okay, well, we'll get started with our frequently asked questions then. And thank you so much. We received a lot of questions in the lead up to the session, including by email. And at the end, we'll also share a slide with where you can direct further questions if you have more. So moving along to the next slide here, Kim, I believe it's actually going to be Dr. McTavish.
I should have just introduced the FAQs. It's me.
That's
I have
okay.
the first one.
Teamwork.
Thanks, Dr. Pigott. So many of the questions, that's actually how the deck was prepared, was by questions that we've had at all of our local health units, from school board partners. So a lot of it will be repetition, and that's by design. So a big question is, what are the requirements for daily screening in school? So we have to do it. I know for a while there was a reprieve, but we're back to needing it every day. So you will bookmark the site that your school board has sent to you, and you will be reporting every day. And then again, how that attestation will look depends on your school board. So many school boards have, a separate link. You sign in with your students, like on their EDSB account or whatnot, through their student ID, and you just say, yes, I have done the daily screening. So that will look different for every school board, but the requirement is every day we need to fill out the daily screening for schools. So Kim, the next slide, please, because it's still me. Perfect. So another big frequently asked question is, my child has symptoms a while ago. We isolated but did not test, which makes sense. People didn't have access to tests. Now they have symptoms again. Do they have COVID again or just a cold? Do we need to isolate? So it's a really great question. So let's say 2 weeks ago, your child had symptoms. You thought maybe they have COVID. You applied for a test and then you couldn't get a test and now they're sick again. So what do? Do you need to isolate again or assume that they already had COVID? You have to do it all again. Every single time you have to do it again. So this is definitely because of COVID, but if you think about what else is out there circulating in the community, other viruses, influenza, we've seen a couple of cases now locally. So there are other things out there, and we want to make sure that those don't also spread, because that also leads to class spread and other people needing to get tested, and we don't have access to tests right now. So we need to isolate again, sort of you start fresh every time you have new symptoms. So again, you would go to the screening tool online, and you would say, these are my symptoms. Am I allowed to go to school? You will likely see that you can't, and it will tell you again how to isolate and what your family members need to do. So next slide, Kim. So this is, thank you. This is me again, frequently asked questions. Also a great question. My child had symptoms a few days ago, and now I have symptoms. How long do we all isolate? So again, that website, that ontario.ca exposed website is very, very good. There's a large section in the middle about the 5 days and the 10 days. In general, the recommendations are your household has to isolate for as long as you isolate. Some health units have gone a little bit further and they've sort of done the leapfrog. You need to isolate from 5 days or 10 days from the last time you've been exposed to that person. So it does depend a little bit on your health unit. If you go to this ontario.ca exposed site, though, it does tell you, for the most part, you isolate with your family. So right now, if my child had symptoms last week and now I have symptoms again, my 7-year-old, lots of symptoms most of the time. So I have symptoms now. How long do we all have to isolate? For the most part, my child now has to isolate for my 5 days as well. So I'm not immune compromised, I'm vaccinated, I'm 5 days of isolation. My son would have to stay home with me for those 5 days as well. Again, if you do this screener, it asks you this: is anybody in your household isolating? Does anybody in your household have symptoms? When you're doing the child screening, and then you say yes, and then it tells you what you need to do. So that's, I think, it for me, Kim. So I think, I'm not sure who's next, but I'll pass it back to Kim. Thanks.
Okay, so I think I'm up, but I did just want to pause and based on what Dr. McTavish said, just acknowledge that this is not easy for families, that this kind of repeated isolation is hard, especially for those families that might have really young kids in daycare or childcare that are bringing home different viruses pretty regularly. it's really challenging. There's not really an easy way around that. I think my hope certainly is that this Omicron wave is going to come. It has come quickly, and that maybe we'll see it go quickly. So these are not measures that are going to be in place permanently. I think we've seen that from other waves, but it's a challenging time. Just wanted to, it's challenging, and it's okay to be frustrated. So next question. How can I tell if my child has COVID-19 if we don't have access to testing? So Omicron is so infectious. It is so prevalent right now in the community that really, if somebody has symptoms consistent with what's on the screener for COVID-19, we just assume that you do have COVID-19. And so if you don't have access to testing, that's okay. We assume that it actually is COVID-19. Next question, please, Kim. Do I need to tell anyone that we have symptoms? So we do recommend that if you have symptoms that are consistent with COVID-19, or if you have a positive rapid antigen test, that you identify who your very close contacts have been for the 48 hours before your symptoms started. And so this is so that you can tell those people, look, I have symptoms now of COVID-19. Either you have a positive rapid test or you just have the symptoms. Say, want you to be aware of this so that you can watch out for symptoms. Those people that you speak to and say that you're now a close contact of, the ask of them really is that they self-monitor very closely, that they're watching for symptoms, just so that we can try and get ahead of this, and they're aware and they can watch for symptoms closely. Dr. McTavish has mentioned a couple of times the website, ontario.ca/exposed, and that will also give you really clear, direct guidance on what to do if you have been told by somebody that you're a close contact, or to help you tell somebody that, you know, I have symptoms now and you're a close contact, so we'd like you to visit this webpage and follow these instructions. Okay, and next slide, please, Kim. What do we do if a friend, family member tells us they have COVID-19? So this scenario is a little bit different depending on if you have, depending on where different people work. So if you're a parent in a household and you work in a highest risk setting, there is different guidance that might apply to you. But in general, if somebody tells you that, you know, that they have COVID, you don't live with them, but you might have spent some time with them, either at a gathering or outdoors, the direction really is that you self-monitor now. And again, more details are available and pretty clear instructions on the website ontario.ca/exposed for that step-by-step guidance. And I believe the next one is over to Dr. Pigott.
Yes, thank you so much. So let's talk about rapid antigen tests. It's really exciting that there is a stock and supply for school children, and my understanding is that supply will increase over time, and they're going to be helpful. They're a helpful extra tool in the toolkit. So if you remember back to that multi-layer protection picture, the one with the Swiss cheese from earlier in the presentation, this is another layer of protection. But some parents are asking, obviously, when the best time to use these are. And so what I would say is that what a rapid antigen test does is it tests for part of the virus in the test in the throat and nose when you take it. And it can be helpful in assessing the likelihood that you actually have COVID-19. In the current context, if you test positive, you have COVID-19. It's clearly COVID-19. The risk of false positive testing results in this context when there's so much COVID out there is infinitesimally low. If you test negative, it could still be that you have COVID-19, especially if you have symptoms. So it's important to continue to isolate. But the reason that 2 kits are going home with parents and with students and that they can be used is if you do have symptoms associated with COVID-19 from the screening tool and you do a rapid antigen test once and then again a second time 24 to 48 hours later. If both of those tests are negative, then the individual could potentially stop isolating earlier because it's very unlikely that they have COVID-19, and they could stop isolating when their symptoms have improved for at least 24 hours, unless they have a stomach or diarrhea or a vomiting type illness, in which case it's 48 hours after the symptoms have been improving. Okay, so again, these rapid antigen tests are useful. We would use them a day apart if somebody has symptoms, and if they're negative both times, it's very unlikely that you have COVID-19. These tests are not meant to be used prior to social gathering or any other way that you could increase risk. Remember, it's an added tool. We should take all of the other measures to protect ourselves as well. On to the next slide and our next question. Will the school be giving out PCR self-collection kits for testing? This may be variable depending on the school board and the school. Schools have a limited number of these tests, and my understanding again, from the school boards, is that they will be used only in limited circumstances, such as when somebody has symptoms at school and they require a test. So this is an extra type of testing that's available, and you'll have to contact your school or school board and or be communicated for more information on this one. On to the next question, and I'll take this one as well. The question was, my child tested positive on a rapid antigen test. How long does the rest of the family need to isolate? Again, we've got a bit of duplication here, and I think Drs. McTavish and Bocking have spoken to this in earlier slides, but unfortunately the household contacts, as difficult it is they need to isolate for the same duration as the positive person. So that's 5 days. If they are not fully vaccinated or immunocompromised, that isolation period is longer, is 10 days. The positive person that tests positive can end their isolation earlier, only if their symptoms have improved for 24 hours and other measures are followed. If somebody has to isolate for 10 then they could potentially end after 5 if their symptoms again are improving. It sounds quite complicated because it is. Things have changed with Omicron, and like Dr. Bocking nicely said, it is a bit challenging and complicated. So anytime you have questions like this, I'd encourage you to go back to the ontario.ca/expose website, because that will really help you to get the information that you need in specific scenarios. On to the next question. There's a question around my child is too young to isolate on their own. What I would encourage you to do for more information is Google how to care for a child who needs to self-isolate. And there's a wonderful Public Health Ontario resource that can be helpful. Really, at the end of the day, we have to be practical and pragmatic. And a parent may need to care and provide care for their child. And so as much as appropriate, use distance, wear masks, but also use other measures to try to prevent transmission. You know, when you're close together, maybe if it's a breastfeeding child or if it's a young child that you're really close to, try to get really good ventilation going, crack a window, crack a door, even if it's only 10 minutes every hour, that ventilation can be really helpful. Disinfection and hand hygiene, those kinds of things can be helpful as well. But really, we know that masks, ventilation, and trying to limit the close contact will reduce the risk of COVID. At the end of the day, you know, I'm a parent. I get this kind of things hard. So the next slide, I'll pass it back over to Dr. Bocking.
All right, thanks, Dr. Pigott. And I think I have a quick one that has mostly been answered already, but just as a reminder, so can parents still go to work if their child has symptoms? It depends on the symptoms. So if the child has one symptom that is consistent with COVID, and Dr. McTavish had listed those symptoms, fever, cough, loss of taste, smell, then no, the parent has to isolate at home. All household members have to isolate at home with the child. If the child has two symptoms that are less common with COVID, but adding up the two together makes it more likely, then all household members have to isolate. If it's just one of the symptoms that are less common, so just a runny nose, nothing else is going on, then the parent can still go to work, but really we'd like to see at least 24 hours for that child to see if they're developing any other symptoms or really what this is progressing to be. And hopefully, fingers crossed, just a runny nose, but we know that often that turns into something else relatively quickly. And then that was a very short one for me, and I'm going to pass it back over to Dr. McTavish, or actually, sorry, Dr. Pigott.
Musical questions. We're passing them back and forth. Thanks, Dr. Bocking. One question we've gotten a lot, and I know I've seen online from folks, is how soon will youth 12 to 17-year-old be able to get their third dose of the vaccine? You know, we know, and this is why we're really encouraging all adults 18 plus to get their third dose, that the protection is better and it's important. At this point, it hasn't been authorized, and I think that it will be coming. I think it will be coming very soon. I don't have specific information on exactly when, but I'm hopeful in the coming weeks we'll have information, and those individuals who are that age will be able to start to get their third doses as well. And over to Dr. McTavish for the next question.
Thanks. Sorry, couldn't get off mute there. Sticky fingers. So we talked about this a little bit earlier. Dr. Pigott did, I think, in his opening statement, actually. So a good question is, do public health units have the authority to close schools when outbreaks occur? So the answer is yes. We've sort of always had that authority long before COVID, if there were concerns. But really, this is done in conjunction with the school boards, about, what are the risks. Schools are best to be open, and we all know that, sort of why we're here. But when there are issues, infectious diseases that just sort of overwhelm our ability to keep schools as the safest place for kids to be, sometimes that needs to be done. And again, that's done in conjunction with our school board partners. So we still have the ability to do this as needed, but this is, again, it's a joint decision. So it sounds like we have the authority and we come in. It's not done like that. It's done in partnership. But yes, this can still happen. So if absenteeism rises to a level where the school and your local health unit is not comfortable, that's always an option. So yes, we certainly can, and we will, if necessary, in partnership. Thanks. So I think it's back to Dr. Pigott.
I think Dr. Bocking was going to take.
That's all right, and I hope we're not confusing people or making people dizzy with the changes. So I hope the information has been helpful. We do have a couple of key messages, and of course, vaccination really, I think, continues to be one of the most important tools that we have in getting through this Omicron wave, and then in addition to any potential future waves of COVID-19 as new variants emerge. Really, for back to school on Monday, key things are completing the daily screening, following the directions related to isolation. If you have access to a rapid antigen test, then to be able to use that rapid antigen test if your child has symptoms or somebody else in the house has symptoms. If you have symptoms or a child has symptoms, that they're staying home, they're not going to school. Wearing a well-fitted mask and changing it if it's wet or if it gets dirty, and washing hands regularly. Dr. Pigott certainly went through the layers of tools and other measures that we have available to help continue to prevent transmission of COVID-19 within schools. I know there's been a lot of discussion on certainly in the media, among parents, among educators, about returning to in-person learning, and I think that really this is a risk of benefits and harms, and there is very clear evidence of the harms associated with moving to virtual learning for long periods of time, and that those harms are cumulative over time. We know that school closures and virtual learning have disproportionately impacted marginalized groups in the community, and in-person learning really is essential for children. There's a couple of different studies that have looked at the evidence of different public health measures in helping to prevent the spread of COVID-19. And it looks at measures for everything from school closures to limiting gatherings, to limiting retail or restaurants, to full lockdowns, and demonstrated its impact on the rate of spread of COVID-19. And while school closures or moving to online only for schools has had some small impacts on preventing COVID-19 transmission, it's actually much smaller than all of these other tools and measures that we have at a community level to help prevent the spread. And so when we take into consideration all of the risks and the benefits associated with it, and we know that the other tools that we have to prevent spread of COVID-19 in schools are there and work well, such as vaccination, ventilation, masking, cohorting, then really public health, I'm hoping I'm speaking accurately for all three of the public health representatives on the session today, that we do support in-person learning, and we will continue to support the school boards, our principals and educators and parents to keep children healthy and prevent any transmission of COVID-19 the best that we can in schools. And I think the next slide is over to Dr. McTavish, and we'll be finishing up in just a minute. Or Dr. Pigott.
Yeah, no, I guess just to finish and echo some of the comments that Dr. Bocking and Dr. McTavish have shared. This is an extremely difficult period. Mesdames et messieurs, je sais que c'est une époque tellement difficile, spécialement pour les parents. Et je veux dire, soyez gentils. I want to say, please try to be kind to each other, be kind to our school board partners, be kind to your kids, and do what you can to get through this period. I think that just getting through and doing the best you can, which I know you are doing, is what's important. So thank you for that, and thank you for everything you're doing, because I know that this pandemic is really taking a toll and is particularly difficult for parents. So with that, thank you everyone that was able to join and listen in. We are here for your continued questions, and we wanted you to see and to hear about how closely we're working with our local school boards to make schools as safe as they can be, as we've said time and time again through the presentation this evening. So there is a slide here that has information on how you can ask questions to your respective health units and find some more information. And I'll turn it over to you, Brittany, to finish us off. But again, thank you everyone for joining.
Thank you very much, Dr. Pigott, and thank you so much for everybody who's joined us here this evening. Yes, as you can see here, please feel free to send emails to your home health unit. They are staffed by knowledgeable experts who can help with your questions. We are here to help. And also this live stream has been recorded. So if you would like to reference any of the material shared this evening, please know you can just go to these websites and you'll find it there starting tomorrow. So with that, I would like to express my sincere thanks to our medical officers of health, our directors of education, and to you, our audience and participants who have joined us on the live stream this evening. Thank you for taking the time out of your evening to join us, and we hope you have found this useful. Please feel free, as I mentioned, to send us your questions and we will get back to you. Do stay safe, take care, and thank you for all you're doing to prevent the spread of COVID-19. Thanks all. Good night.